Good morning, everyone. This is Dr. Namita Joshi, a speech language pathologist from Semantic e-Polyclinic, Pune. I am also a speech and voice therapist at KM Hospital, Pune. Today I am going to talk about semantic pragmatic disorder, a disorder which is increasing in numbers day by day, which can be due to the effect of screen time, increase in screen time of children, or increase in the social distancing because of the pandemic. It is often misunderstood as autism, and children with autism has lot of commonness and commonalities between semantic pragmatic disorder and autism. There is a lot of similarity. So we are going to just see what are the similarities and what are the differences and how to treat semantic pragmatic disorders, what to do when the child has this problem, because this problem can actually go and grow into further deeper language disorders or language problems in higher grades. So we have to identify this, like say below 30 to 36 months, and we have to start treating this problem so that the child doesn't end up having any emotional, social or any pragmatic issues in the later stages. So let us move on and see the presentation. So the statistics shows that there is rise in the problems with social skills and related disorders over last decade. So you can see that initially the problem was say 1 in 150 children, and now the problem is just 1 in 44 children. So autism as per se has been really increasing. One of the disorders like semantic pragmatic disorder, where the problems lie in social skills and related skills. It is more common in boys and it can be identified below 30 months, and social distancing and screen time has to play major role in now increase in semantic pragmatic disorders. Absolutely, there were before also semantic pragmatic disorder was before present before pandemic as well, but the awareness and the symptoms are getting more obvious, and the children are becoming more and more deeper into these problems nowadays. So we have to really know how to tackle and how to identify these problems and how different semantic pragmatic disorder is from autism. Moving on to the next slide. So as you can see, autism has problems in social skills, it has language impairment, it can have behavioral issues like flapping of hands, jumping, toe walking, it has restricted interest that the child doesn't want to communicate, doesn't want to mingle, child is not interested in the outside world, he is more and more focused into self and deeper. स्वमग्नता आपण ज्याला म्हणतो स्वतःमध्येच मग्न असणे. But semantic pragmatic disorder has more issues compared to social skills. Compared to autism, they have more issues in social and language impairment than restricted interest and behavioral issues. So you won't see a semantic pragmatic disorder child probably flapping hands or visual cornering or jumping or getting any behavioral sort of thing. It will definitely have better interest and like to communicate. It will not show restricted interest. The child will show you interest in communication, child will want to communicate with you, child will want to participate in different activities you actually do, but they lack the skill to actually participate in the game. They lack the skill to actually mingle with the children. So they won't exactly know how to talk to a child who is sitting next to them in the class. They won't definitely be able to tell you, okay, what happened today in the school. So especially many parents come to me and complain की आज शाळेत काय झालं ना ते सांगताच येत नाही त्याला. So they are not able to do these skills. They have language problems. They are not probably able to speak in sentences. They are just speaking words. They are not able to express what they actually can think. This is the main difference between the semantic pragmatic disorder and autism. So as you can see in the next slide, you can see in one x-axis you have meaningful verbal communication from abnormal level to the normal level. So autism is more affected in terms of meaningful verbal communication than semantic pragmatic disorder. And even on the y-axis you can see relationships and social interest. So you can see that child with semantic pragmatic disorder will have more normal levels of relationship and social interest. So it will show you that there is emotional content. So they will have, mother and child will have proper emotional bonding, which is definitely lacking in children with autism. And semantic pragmatic disorder, children with semantic pragmatic disorder will also have more meaningful verbal communication than the children with autism. So they will know what to speak, they will know how to speak, but they will not know how to speak. Okay, they will know, like, okay, so if somebody asks me some help, I am supposed to help, so that the child will help, but they will not know to say thank you or welcome or sorry. They will not know how to guide for certain activity, like, okay, if I want to color, they will not be able to say I want the red pencil and I don't want the green pencil, because the leaf I want to color is colorful, or I don't want to color the leaf green color. They won't be able to tell you this exactly. And because of that, you will feel the child is snatching, or child is not listening, or child is not able to express. Okay, so moving on to the symptoms. Poor language processing. So if you tell them once, they probably will get confused, they will not understand just telling them once. You may have to repeat the instructions for them. It's like, okay, go bring your shoes for the school. Okay, go bring your black shoes today because it's not your sports day. So they won't do it in the first go. They will have to be told repetitively. They will not know the use and understanding of particular object. For example, they will not be able to do pretend play. For example, when the child learns pretend play, we play bhatukli, or we play something and we try to make things out of it on our own creatively. So the child will not be able to do those things because it has poor language processing, and use of language is really affected. They might have parrot talk, which is also common between the autism and semantic pragmatic disorder, which is also officially called echolalia. They can copy phrases. So, what is your name? If you ask the child is going to repeat and say, what is your name? They will not answer, my name is Namita, or something like that. Repetition of some behavior or verbal language, repetition of there is non-meaningful chatter, so they'll continuously keep speaking something which has no meaning or no sense. So jargon, basically jargon speech or gibberish language. They will have their own language to speak, and then they will tell it with full emotional expressions and hand gesturing and all, but you won't understand what the child is trying to say. Poor turn taking skills, difficulty maintaining a topic conversation. Suppose you ask, okay, did you go for picnic yesterday and what did you do in the picnic? They'll be like, okay, picnic, but my father needed a ride, I went, and then my mother cooked rice for me. So there is no maintenance of the topic. Whatever comes into that distraction, so suppose you have kept something, a tiffin on the table, or you have kept a pen on the table or a bottle on the paper, so they will not be able to continue that thought. They will shift to something which is more visual in front of them. Social difficulties, not knowing how to be with people. So if there is a child, so they may not share their toys, they may not talk to the child, they will run away from the social group or peer group. They will not know how to be in groups. Difficulty responding to questions. So WH questions like how, when, what, where, who. They will not be able to tell these answers to you if you tell them a story or show them a picture and ask, okay, who is going with the child, or where is mama going with the baby. They will not be able to tell you that. They will just probably may tell you that what it is. Okay, difficulty also in talking about particular subject or object. So they will have beating around the bush phenomena. They will not talk exact specific things. So you ask, okay, tell me about 5 different animals staying in the jungle. So they will remember 1 or 2 and they will not be able to tell others. They will start talking about the animal baby's name, or they will talk about animal characteristics, but they will not be able to say the names of the animals properly, or they may shift the topic completely to something else. They don't want to talk about those animals. They may not answer you the question. They will just talk about, I love jungle, I want to go there, I want to stay, then there was a snake. They will just talk about something else if you asked about something else. All younger children tend to speak in jargon with wrong and inadequate words. So this has happened and increased also due to screen time. So I have patients coming to the clinic who talk like a cartoon. So if they see a cartoon, suppose Doraemon, or they see Cocomelon or Dinah videos from the YouTube, then they will talk like them, they will have accent like them, they will have pronunciation like them. And the mother and father, they're not understanding English or Hindi, they just speak Marathi at home, and the child is speaking in Hindi and English without the exposure of the physical relation, but the child is learning only from the screen, and that is not meaningful as such. The child is not able to tell you meaning with it, but he'll just blab a few phrases or sentences which he has heard in the morning today. So this is very, very common. And made up words, semantic neologisms, that they will make their own word. If they don't remember the exact word or specific thing they have to say, they'll make their own language and their own words, new pronunciations for the same word. Okay, so these are the symptoms of semantic pragmatic disorder. So all of you can identify these symptoms below 30 to 36 months of age, and we can early identify these children and really work on intervention. So how do we check when you come to clinic? How do we know that the child is having this problem, or we have control over this problem? How do we know that? We ask these questions, and we know that these particular categories can help us identify the child. So what are these categories? Speech output, intelligibility of speech output, fluency, what is the rate at which the child is speaking, how fluently the child is speaking, how are the grammatical structures in the phrase, what is the phrase length, what is the coherence between what they talk, what is the whether they talk inappropriate initiation of the topic, like if they're not able to initiate the particular object talk or subject talk or picture description, stereotype conversation, like over precise manner or information, favorite topics of conversation. So overuse of certain, like many, use of conversational context, conversational rapport is not there, social relationships are affected, like they don't have friends, they don't have social interest, they don't want to do anything with the groups. So if you really ask these three small questions to yourself, ask the child to tell small story and watch out the sound clarity. See if the child plays with the other kids and say thank you, excuse me, sorry, if he has that bonding with the social skills. And ask the child to converse and sustain on the same topic. Ask him the questions and see whether he is able to answer those questions, or he talks irrelevant sentences, he's not talking about from the story. So do these three things and know that if your child has this problem. Also, the intervention in this starts with the first identification of what exactly is missing. So we have this receptive expressive language test, reels. We also have social quotient to identify whether how badly the child is deeper in this problem. We also have pragmatic profile test, preschool and school going children, where we test the pragmatic skills, that is how to use the language in the context. And the easy to use OPD basis checklist I've just shared with you, that just get this done from teacher as well, and the parents yourself, you can do this. Follow routines, follow rules of the games or any activity, points when requested, identifies items, label items, make request, comments on something, response to questions, ask questions. At the age of 30 to 36 months, if the child is able to do these things, then the child is not at risk. But if the child does not do these things, then definitely child is definitely at risk for developing semantic pragmatic disorder or pragmatic language problems. Then what are the therapies to do this semantic pragmatic or social pragmatic issues? You definitely have to do lot of speech language stimulation activities with the child. Tell the child stories, talk to the child every day, make sure you are not yourself on the phone, make sure that you are building the vocabulary of the child according to the age, make sure that there is good parent child interaction with you. You have this checklist, like have you done this age wise, you are trained to do parent child interaction. So from Semantic Polyclinic we also do parent child interaction training programs. So if you want to enroll, you can contact us and enroll your name for how to communicate with your child. Okay, there is a proper course on how to communicate to your child, especially toddlers, and how to build in the speech language and the emotional bonding with your child. Reduce the screen time, don't show the mobile. Below 2 years, a child should not see a mobile even for a minute. After 2 years, the child can be shown the mobile with supervision of the parents. That means it should be interactive and not just watching the YouTube videos. So maybe some games academic, which can be like press this button, circle this, okay, do something similar to what is shown in the diagram or the screen. You can have this interactive games for 20 minutes after 2 years, but not before that. Syntax and social skills training group is also very much important, so the teachers and the caregivers in the house can also take care of the grammar part. So most of the parents talk with the children, or teachers talk sometimes in just main words or keywords, and the child is not really exposed to how the sentence structure in the language is. So the child also does not actually respond in that way. So you have to start, even if the child is just 2.5 3 years, you have to start talking in full sentences. No madris, no childlike talk to the child of 3 years anymore, or 2.5 to 3 years anymore. You have to talk like an adult, but short phrases, and use lot of words which are commonly used between the adults. So not very difficult words, easy to pronounce words, short phrases are the few tips for the parents who can train the children for how to speak the oral language or grammar part of oral language. So you have to teach them verbs, you have to teach them like, okay, there is a subject and verb combination initially, okay, mama come, papa let's go, and then slowly start, okay, mama give me water, mama I want to eat apple, and slowly so on. So communication interest developing activities, like from the routine, like you have to set a routine with the child. So there is specific time for the interest developing activities like coloring, painting, clay, or drawing, or sports, any sports activity, or joint reading sessions with the parents, or group activities like a child goes to a sanskar varga, or any evening activity groups where you can send the child to have that communication or interest developing activities with his or her peer group. So these are the main things which you have to remember for therapeutic interventions, so that the children overcome this semantic pragmatic issues in early stages, and it doesn't hamper their academic as well as emotional development in later stages. So this is what about like take home message. Pandemic has increased semantic pragmatic disorder due to excess screen time, social distancing, no communication among the family, poor parent-child interaction. So get trained and use the proper speech language stimulating environment for your child. Do proper parent-child interaction techniques with your child, so that the child improvises in your speech language and pragmatic aspects or social aspects. Cartoon talk, parrot talk, unorganized thoughts, irrelevant context in talk. Identify these symptoms as semantic pragmatic disorders and consult the professional. Guide different other parents if at all you see other children having these issues. So parents should guide each other and send them to a speech therapist, occupational therapist, and remedial therapist. These 3 therapies are required for the children who have semantic pragmatic issues. Children can also be taken to developmental pediatrician, get them evaluated, and then start the therapies. Children can completely overcome semantic pragmatic disorder if it's not genetic and identified early, in early stages. They can have the social communication developed and social interest develops if it is identified early. So this is the end of my presentation. If you all want to contact us or book us some evaluation or some sessions for the parent-child interaction, you can contact these numbers. These are the numbers for Katraj branch Sampark e-Polyclinic and Kothur branch Sampark e-Polyclinic, and the website is also given here. You can contact us anytime if you see the children have these problems. So if you see that the child is not speaking in full sentences by the age of 3, the child is not speaking in the relevant context, or child is avoiding to talk with the peer group or avoiding to mingle in the peer group, child is not able to adjust in a social situation. If you go for a party or a birthday party, the child is not able to give answers to the questions like what, where, who, when. If the child is not able to listen and do the particular activity in one go, you have to repeat the instructions a lot of times. The child is inattentive overall, not having interest in doing any activities you actually bring in home or toys bring in home. Please contact us, don't get it delayed. If you identify it before 36 months, it is really easy for us to work with the child and get the child overcome those issues. So thank you so much for attending this particular and watching our YouTube videos. Please like, subscribe and share this video to as many as you can and who you think will benefit. Thank you so much. Have a good day.